We're talking about the predicament that many Americans find themselves in today, money versus medicine. Dr. Makary, let's get to some questions because I think these will help tease out why things get so expensive. We actually posted on social media looking for viewers who had questions about insurance, billing, and all things healthcare. We were sent so many wonderful questions. This is one from Chelsea. My doctor sent me for blood work and I recently received 2 separate bills from the lab for a total of $567. In small print, it said, these services are not covered based on the diagnosis reported by physician on both bills. What do I do?
One of the biggest money games I found in the research for the price we pay in the last 5 years in American medicine has been if you as a business can take your service off that master hospital bill and bill directly, bill out of network, even at an in-network hospital, you can get a lot more money out of doing that. So we've seen air ambulance bills pulled off the master bill, labs, physician groups now owned sometimes by Wall Street companies coming in, buying them in bulk, taking their services off the master bill, and they hit you later. That's a surprise bill. That violates the public trust.
So these are not surprise bills that, oh my gosh, I'm going to have to take that down payment for the car. These are, I'm going to lose my house bills that we're talking about here. So when you get a surprise bill like this, what's the first step you should take?
You should really try to get to the hospital and talk to somebody, make your case. Most places, when we talk to the hospitals, they're happy to be lenient, but the problem is you have a tough time getting to those people. You got to fight, you got to go beyond the call center rep, you got to make a plea. Find your local hospital board members if you feel that you've been unfairly charged. They're members of the community. They're liaisons to the town, and you can tell them, hey, this situation, I can't tell you the number of times I've seen it. I bet you guys have seen it too. A doc or one of our friends gets hit with a massive gouged bill, and they have a conversation with an executive who then reduces it or takes care of it. That shouldn't be limited to those with access. They should be pricing things fairly.
Let's move on to a question that came to us from Instagram. What is the most affordable plan for a single, healthy 29-year-old? So far, only finding $400 per month options, and I can't afford that.
Well, if you can't afford the price of health insurance, look into alternative options like faith-based co-ops. They're often captive or cash-sharing options where you literally pay into a pool of money and then they distribute that money after you hit a $10,000 deductible. High deductible plans are not bad. They sometimes have lower premiums. And when you're paying out of pocket before you hit the deductible, you can fight and negotiate and preset prices before you get care. That's one of the reasons we're seeing a move to price transparency.
So we have everything solved. We'll see you next time. I had to bring some levity here. Someday, some way, somehow, there's going to be more transparency and we will have fewer conversations like this.